Thank you so much for the invitation, Gordon. When you gave me this title, I was like, it's normally easier to rehash a few talks and put things together, but this is a talk I've made from scratch. So I've learned a lot. And actually, it's going to be a little bit different to what we normally talk about when we're doing orthopedic presentations. We're going to actually talk about what we tell our physios to do. So exercise, go and strengthen your quads, you'll be fine. That's not enough. We need to get an idea of what the physiotherapists are doing, and hopefully this will be an education for everybody. So I've admired Gordon from a distance. I've always sort of learned about his work that he's been doing, the internal brace work, and it's always been fascinating. But to actually share a stage with him at Conrad's meeting in Warsaw was slight imposter syndrome. And then I got double imposter syndrome when I got asked to come and give a talk here today. So I'm very grateful for the invitation. This is a typical scene in theatre for myself and Adrian. Every single case that we do it together. Whether it's a simple knee arthroscopy through to a complex osteotomy or joint reconstruction, the patients get two surgeons operating on them. And the third familiar face in there is Christian Clay. So on a really good day, we've got Christian there or Ronald there as well. And for those of you who don't know, I was a fellow to Adrian nearly a decade ago now, and I've been very fortunate to continue that journey with him. So we're going to talk about what programs exist, what do they have in common. I'm going to go through each of the exercises because your patients will often ask you, what exercises can I do, doc? And then finally, we're going to make it into more of an orthopedic talk and talk about what the evidence is. So those of you who know Adrian's an innovator and he's always ahead of the curve. So he came up with this concept of a warm-up protocol for preventing ACL injuries off the back of stuff that he had learnt on fellowship in Australia, but in the UK we didn't have this. So we put together a series of videos together with a physio, Ben Wild, who is not, you can try and figure out which one he is, he's not the child, that's him. And so we came up with these 7 years ago, 8 years ago, before Power Up to Play was on the scene, before all these things that are now commonplace in the UK. So this is something we've been thinking about for quite a long time. The one that everybody will know about is the FIFA 11 program. These are 10 evidence-based exercises, and the 11th part is the promotion of fair play. And they all focus on the same things of core stabilization, eccentric training of the upper legs, proprioceptive training, dynamic stabilization, as well as plyometrics. But even before that, at the Santa Monica Medicine Research Foundation, they were talking about pretty much the same things. And a lot of the evidence we're going to present today came off the back of this clinic. All of these programs focus on addressing the increased hip adduction, decreased hip abduction control, increased hip abduction angle, and the increased internal rotation moment at the knee. So as part of the warm-up, the things that the physios will go through and the things that those that are being trained will need to prepare for is jogging line to line, and that ensuring that your knee doesn't cave in as you run, feet not whipping out, doing shuttle runs to try and get your hip muscles engaged as you're running, focusing both the inner and the outer thigh. You're then looking at backward running to engage your hip extensors and hamstrings and ensure you're landing on your toes. So the one that we all know about is getting your quadriceps strong. And an easy way of doing that is a 90-90 position, getting your both legs flexed with your knee just a few inches above the ground on the back leg and your front leg at 90 degrees. The one that I've heard of but had never ever done in my time training or seen people train are Russian hamstrings. And this is perhaps one of the most important parts of your warm-up protocol and perhaps one of the hardest to teach. So this is a program where you hold onto the feet at the back and you get the athlete to gradually extend at the knee until they come to the ground. And that's really good for your hamstrings. We all know single toe raises, they're pretty straightforward, and that's there to strengthen your calf muscles and improve your balance. Nothing new there. Plyometrics. Does everybody understand what plyometrics means? No? No, exactly right. So we all talk about plyometrics. So actually plyometrics is there to help get you explosive, build power, strength and speed. So whenever we talk to particularly our netball athletes who are doing jumping sports, it's really important to land onto the ball of your feet and rolling back on the heel. One way of doing that is to do lateral bunny hops. So these are having a line down the middle of your pitch, So you go either side, and these help to control your strength, doing forward and backward hops over a cone, so going both forwards and backwards, and then finally doing the single leg hops over a cone as well. So these are the single leg exercises which can be incredibly challenging to do if you're weak in certain muscle groups, and you need to be able to do these as part of your warm-up. And then finally, vertical jumps with headers. Now, some people are exceptionally good at this. I thought this is pertinent with Ronaldo when he was playing for Juventus. And getting up at that sort of height is not what we expect our athletes to do, but it's actually a really important part of the game. And then finally, scissor jumps. We move on to the final section of the rehab program, which is the agilities. So the first thing that we get the athlete to do is to do a forward run and a 3-step deceleration. So this trains the muscles on how to stop safely without putting excessive stresses across your ligaments. So we do that going forwards, and then we do the one that we typically see, sorry, the video is not great, but doing the lateral change of direction movement as well. And the final arm to that is the bounding run, and this is there to help increase your hip flexion strength and increase power and speed. The bit that we forget often is the stretching element. So this is when we're part of the warm down, and these are all really straightforward. So you've got your calf stretch using a wall, or you can use one of your teammates to do this with. Get your quads stretched out, and the figure of 4 stretch. And then finally you do the last two are your inner thigh stretch, they're easily done, and then your hip flexor. So what is the evidence? Well, there's lots of good evidence out there, particularly with the FIFA 11 program and the Santa Monica program we mentioned earlier. So a name that you're going to frequently see is by Bert Mendelbaum, who's been instrumental in developing these programs and doing the research on them. And in this particular paper, they looked at 850 players in the control group and 675 in the intervention group. Now this is a really busy slide, so I'm just going to break them up into individual components. And the headline from this is that the total number of injuries reduced, but also specifically the knee injuries reduced also. So it's not just good for helping with your knee problems, but also other limbs. The mechanism of ACL injury, when they did occur, was more typically, as you would expect, in the non-contact group. And that was obviously interesting to be demonstrated on there. But interestingly, the patients in the Division 1 did not have a significant improvement in reduction of their ACL ruptures. Now there's a lot of factors that may have played into this with other associated injuries, and it was only in the Division 2 that they had a statistically significant reduction in the number of ACL ruptures. So what they concluded was that using the FIFA 11 program, you were able to reduce the incidence of ACL injuries in competitive collegiate male soccer players by 77%. Another paper, once again by Bert Mendelbaum, being involved with this, was looking at the effectiveness of neuromuscular training and proprioceptive training in preventing ACL injuries in the female athletes. So we now know this to be a huge problem. You're reading about it in the papers all the time. Those of you who follow the Premier League will see a lot of the England national soccer female players are getting ACL injuries. So this was a study looked over 2 years, 2000 and 2001. They had over 1,000 in the first group and 844 in the following year. And what they found was that there was a significant reduction in the number of ACL injuries in the trained group, and the overall decrease in ACL injury in year 2000 was 88%, and similarly 74% in 2001. So it's a bit similar to the paper we were looking at before, where there's a 77% reduction. It's a huge reduction by just following those simple steps that we've mentioned. And they looked at why, particularly in the female population, are we getting increased ACL injuries? Is it due to anatomic consideration with the wider pelvis and shape? Is it due to do with the narrower notch that we see in the female population? Is it the size of the ACL? We know that certainly there are issues related to the ligamentous laxity, particularly around the menstrual cycle. So we know that estrogen, progesterone, and relaxin are found within the anterior cruciate ligament. And these increase, you get increased amount of estrogen and relaxin at around the menstrual cycle. So we know there's around the ovulatory phase of the cycle. So we're a lot more aware of it. It's a topic that people are much more comfortable talking about compared to a few years ago, and there's a lot more science behind it. Extrinsic factors are applying to both a male and female population, can be related to weather, playing surfaces, the kind of footwear we're wearing, playing all year round now, and bracing. So what they concluded was that prophylactic neuromuscular and proprioceptive training directly benefits decreasing ACL injuries in female athletes. So in conclusion, ACL ruptures continue to be on the rise. We know it's a bigger problem in the female population compared to a male population, and we're doing there's a lot of work going on to try and reduce that. The programs work, and there's a lot of evidence to support it, but I think this is something that needs to have greater awareness. I've got a vested interest. I look after my son's rugby team. They're all coming up to an age now where they're going to start doing a bit more. They're doing contact already, but I think if we start at an earlier age group, we're much more likely to influence their ACL ruptures. Thank you.